You already had a precious baby, but there is a little problem. His skin is blue.
Oh my god, it's blue!
He suffers cyanosis, a sign of a low concentration of oxygen in his tissues. But we don't know which is the disease that provoked it yet. Maybe a respiratory disease, a circulatory disease, or who knows, maybe this is unusual color is provoked by methemoglobinemia.
Having a look at this baby's family tree, we discovered that some of its ancestors were blue, following a recessive pattern. We also discovered that they were diagnosed with methemoglobinemia. That means the baby must suffer it too.
What is methemoglobinemia? It is a disease due to a higher proportion of methemoglobin than normal, which causes blue color in the skin and brown in the blood. Methemoglobin is the oxidized form of hemoglobin, which has iron 3+ instead of iron 2+. This causes a lower affinity for oxygen, since methemoglobin is not able to bind to it.
There are two types of methemoglobinemia, congenital and acquired. Within the congenital, we are going to detail two types. The first one is autosomal recessive, which is due to a mutation in the CYB5R2 gene on chromosome 22. This gene encodes the cytochrome B5 reductase enzyme, responsible for reducing methemoglobin and maintaining it at physiological levels. The mutation reduces its function, developing methemoglobinemia. It is a mutation that follows an autosomal recessive inheritance. In this type, we can find two subtypes. Type 1 is characterized by producing a reduction in the function of the enzyme in erythrocytes, causing an increase in methemoglobin compensable by other cells. In type 2, the enzyme reduces its functions in all cells, which causes an important increase in methemoglobin that is not compensated by other cells.
There is another type of congenital methemoglobinemia. It is called hemoglobin M disease, which is characterized by the presence of hemoglobin variants with structural abnormalities in the alpha, beta, or gamma globin genes that prevent the reduction of methemoglobin. They are dominant mutations. Furthermore, acquired methemoglobinemia is the one that occurs after exposure to certain substances such as anesthetic, nitrobenzene, certain antibiotics, or nitrates that favor an increase in the production of methemoglobin.
At the treatment, if the illness is complicated, they need oxygen support for high their levels. The principal treatment is methyl blue, that is an electrode donor, which acts like an alternative route of cytochrome B5 reductase. With the time, they change their skin to a normal coloration, and they need to take a pill every day to keep the normal skin color.